Did you know that there are essential facts about double mastectomy that your doctor may not tell you? He may not tell you because he may not know the evidence in sufficient detail to explain them to his patients. Shocking enough to want to discover more? Join us to explore the evidence. To begin our exploratory journey, I will start with this article, collaboratively written by a panel of experts who gathered at the 13th European Breast Cancer Conference. This manifesto was published in 2023 in the European Journal of Cancer. Before we proceed in our discussion, I would like to explain a few terms which were used frequently in the article and which we will use often in this video too. Firstly, CBC is short for contralateral breast cancer. This refers to cancer occurring in the other breast sometime in the future. Contralateral prophylactic mastectomy, or CPM for short, describes the surgical removal of the unaffected breast in women who develop a unilateral or single-sided breast cancer. When doctors speak of CPM, it generally implies that a bilateral or double mastectomy is planned for or has been performed. Back to the article we are reviewing together, the expert panel recognized that there were differing levels of knowledge of the risks of CBC or contralateral breast cancer among doctors. Physicians with a low knowledge of the risks of CBC were more likely to consider contralateral prophylactic mastectomy, meaning double mastectomy, than physicians with a high knowledge of the risks. How did they come to this conclusion? The experts looked at prior research done by a team led by Dr. Cantor from the Department of Surgery at the University of Chicago. In her study, 1,170 physicians participated and were asked to provide an estimate of the risk of contralateral breast cancer. Slightly more than half of all the participating physicians, or 52.6%, had high knowledge of contralateral breast cancer risk. Of the 4 physician specialty types that participated, plastic surgeons were the group that had the lowest proportion, or 29.9%, with high knowledge about CBC risk. This excerpt from the study by Dr. Cantor and colleagues illustrate how the physicians responded when asked whether they would favor insurance coverage for CPM in women who had average risk of contralateral breast cancer, as well as in all cases. If you scanned the results, have a quick eye, and are a genius at statistics, you would be able to discover the fact that physicians with different levels of knowledge make different treatment recommendations. Compared with physicians who had high knowledge of CBC risk, low knowledge was significantly associated with favoring insurance coverage for CPM in all cases and for patients at average CBC risk. In other words, doctors with a low level of knowledge of the risks of contralateral breast cancer, or CBC, were more likely to recommend double mastectomy. Conversely, more than 60% of doctors with a high level of knowledge about CBC risk oppose insurance coverage for CPM or double mastectomy. So the level of knowledge of CBC risk may lead to differing recommendations for CPM or double mastectomy. This finding was corroborated to some extent by a separate study done by Dr. Yao and her team, where, having done a survey among surgeons, it was found that 4 out of 10 respondents had a low level of knowledge about CPM. Let us return to the manifesto. So what exactly is the risk of CBC for women who do not have a gene mutation and are not at high risk of developing recurrence? Having carefully evaluated the research done on this subject, the expert panel estimates that the risk of contralateral breast cancer is approximately 1.9% over 5 years. Allow me to repeat this. The likelihood of developing contralateral breast cancer is approximately 1.9% over a period of 5 years. How does this compare with the risks of undergoing CPM or double mastectomy? The risks of undergoing CPM have also been studied independently by other researchers. The Cochrane Library commissions systematic reviews on medical topics. One such review was led by Dr. Carbine on the subject, or risk-reducing mastectomy, or RRM. RRM is the broad group of procedures under which CPM falls and has very similar characteristics in terms of surgical outcomes. It was found that adverse events from RRM resulting in additional unanticipated reoperations ranged from 4% in women without reconstruction to as high as 64% for those who undergo reconstruction. In another study, Dr. Unukovych led a team of researchers to study longer-term outcomes in women with contralateral prophylactic mastectomy. His team found that up to 60% of women who underwent CPM were found to have body image issues and therefore poorer quality of life years after surgery. You may wish to pause the video to take note of the references from which these findings are presented for further self-study or verification. In summary, we know that the risk of contralateral breast cancer for women without gene mutations is approximately 1.9% over 5 years. The risk of poor outcomes with double mastectomy may be as high as 60%. Recall that the lowest complication risk of mastectomy without reconstruction is estimated to be 4%, which is about twice the risk of developing contralateral breast cancer over 5 years. This comparative risk is something to bear in mind when making a decision about which surgical treatment to choose. While this forms the main risk profiles that a patient needs to know, there are also other domains which may be important. We return now to this expert panel and their recommendations. They compiled a list of at least 10 points which should be discussed with patients making a decision about CPM. Some of these topics we have already discussed. If you wish to have this list for free, please submit a request through the Just Medicine website via the link given in the description below. Just Medicine is dedicated to presenting facts based on sound scientific evidence relating to breast cancer surgery. While we hope this provides clarity for women who will be making a decision on their surgical treatment for breast cancer, please note that this is not a substitute for a surgical consultation. Do see your doctor to discuss the appropriate therapeutic options for your unique circumstances. Notwithstanding, if you have found this information useful, kindly click on the like button, comment below, submit a request through the Just Medicine website, or subscribe to this channel. This will encourage us to produce more videos that will help women help themselves live longer and live more after breast cancer treatment. Looking forward to chatting again real soon.